Talk about Obamacare. HHS finally releasing information on insurance premiums, claiming costs will be lower than first thought. But, Karl, you just tweeted, don't believe HHS. Happy talk. Obamacare will increase average individual market premiums by 99% for men and 62% for women. Karl, last night I had a gentleman on here who said just the opposite. So how do I know who to believe about what on this?
Well, read the fine detail on the report that came out of HHS. What the HHS did was it compared their current estimates of costs for some of these the cheapest bronze, silver, and gold policy and the second cheapest silver policy to what they'd originally estimated, to the original Congressional Budget Office projections. They're not comparing it to what you're actually paying. They're comparing it to what they thought you might pay. Now, you're right. If you take a look at it and compare what the rates are in their estimates to what people are currently paying, young men on average are going to pay between 97 and 99% more than they currently now pay. They'll pay less than the CBO originally projected, but they'll pay more than they pay now. Young women, 55 to 62% more. North Carolina men get hit the worst. They will pay, if you look at the current rates in the state and compare what Obamacare is going to require them to put out of their pocket, it's a 305% increase. And Nebraska women are going to get hurt the most among women. They're going to be a 237% increase over what they currently pay.
Where do you get your numbers? Where do you get your numbers?
Well,
everyone keeps throwing numbers at me, and okay.
Here's where people ought to go. Manhattan Institute began several months ago getting information from individual state insurance commissioners about the current rates that people are paying for their premiums for health insurance, and they've got this up on the internet, so you can compare what Obamacare is going to cost you in your state compared to what you're currently paying on average. Manhattan Institute. The project was overseen by a brilliant young man named Avik. It's really good. They don't have all the states because not all the states have supplied the information, but you can find in there a pretty interesting explanation of what you're now paying versus what you're estimated to pay by the government. I'll give you two examples. 27-year-old using the cheapest bronze plan. That's the cheapest plan that the government is going to allow you to have versus the lowest cost currently available coverage. In Wisconsin, I know you're interested in this, that will be you will pay 384% more for the cheapest plan that the government's going to allow you to have versus what's currently available. In Louisiana, it's going to be 379% increase over what's now currently available. So, yeah, the government is basically lying with numbers. They said, oh, we estimated it would be this much, but it's really only going to cost this much, but we're going to leave out the fact that you're paying this much. And I think it is really scandalous that Secretary Sebelius, in a shameless attempt to promote Obamacare, is putting her imprimatur on this really misleading, deceptive. Look, if the government could be sued under by the Federal Trade Commission for deceptive advertising, Secretary Sebelius would be slapped with lawsuits today about a mile thick.
Well, you know, a lot of viewers have written me very upset about their premiums. They say they're going up. I urge any viewer who's getting a good deal or thinks the premium is going down for that person, please write me, because I would like to have, you know, both sides. Just email me at our show account.
I got a good deal. I got a good deal on my premium. I got a good deal on my premium. I just signed with my insurance company early so that I can carry my plan over to 2015 rather than wait until its expiration date after October 1. Rove and Company, with massive number of 4 employees, we extended our coverage. It was the only way we could avoid seeing our premiums skyrocket dramatically, and it only gives me 1 year breathing room. But you're right. I mean, again, the average American young man is going to pay almost twice as much for insurance than they're now paying. The young woman is going to pay almost 2/3 more than she is now paying. And in some of these states, it's going to be very dramatic. And again, I repeat, HHS told a bald-faced set of lies today by comparing its newest estimates to some old estimates and saying, ain't it going to be great? You're going to pay less than we thought you did, but left the impression it was you'd be paying less than you're paying today. Simply not true in virtually every state in the union.
All right, let me ask you this question: is that a young person who doesn't buy any insurance can get insurance if he or she gets sick, or if it gets caught, has to pay a penalty? Does that penalty exceed what you pay? Or which is more expensive, to buy the cheapest health insurance, or to see if you can get lucky and not get caught? And if you do get caught, you can buy something.
Next year, the penalty is $95. So how many young people are going to be enthusiastic about going out and signing up for insurance prematurely if they know that, A, if they never need insurance next year, their penalty is going to be $95 when they pay their taxes in 2015, or if they do get sick, they can go out and immediately apply under the new under the Obamacare law and not be denied immediate coverage because of no pre-existing condition requirements. So look, this is why the government is so hepped up about trying to get younger people to sign up, because two reasons. One is they're afraid that if they don't get them at the beginning, it's going to be harder to get them later on. And second of all, the economics of Obamacare require them to get younger, healthier workers who, under the law, are required to pay more than they would otherwise pay in order to subsidize the coverage for older, less healthy workers. They want to have at least half of the people they sign up next year be younger, healthier workers so that they can subsidize the less healthy people.
And I got to go. Karl, thank you very much.